Hi, my name is Sameera Hasan, and I'm almost finished my second year of respiratory therapy at Fanshawe College. Before applying to the program, I wasn't really sure what an RT did, so I had done a bunch of research, and I also job shadowed an RT at the hospital. Overall, I chose to become a respiratory therapist because I've always aimed to work in healthcare, and after 2 years of this program, I've come to know the wide scope of skills and responsibilities that RTs have, both in the hospital and in the community, that are of interest to me. Every day is very different for an RT, and I like knowing there's a challenge. And we're also very important for many different patient populations, and I like knowing that I can help patients and make a difference. Recently, I've also become really interested in the role of the RT in the community. This is because we learn of the growing trend of healthcare towards home care because of the many benefits it has for the patient and the healthcare system. So the patient is able to receive treatments in the comfort of their own home, which leads to a sense of confidence and independence, which is important for the patient's health. In terms of the healthcare system, being able to educate patients outside of the hospital can help to reduce the number of patients that come into the emergency. So for instance, being able to provide proper asthma and COPD education outside of the hospital can help to reduce the number of exacerbations that lead to hospitalizations. This not only helps to improve the patient's quality of life, but it also reduces a burden on the hospital emergencies. Overall, I aim to successfully complete this program and to be able to provide safe, competent, patient-centered care wherever I'm needed as an RT. So for today, I'm going to be going through two breathing exercises for shortness of breath. The first one is called pursed lip breathing, and the second one is SOS for shortness of breath. The first technique that I'll be going through to help manage shortness of breath is called pursed lip breathing. This is a very common method, and you're going to want to first try to relax your muscles. You can sit down if you want, or you can do this standing up as you're comfortable. You're going to inhale through your nose and then exhale through pursed lips. So pursed lips is kind of like the lips like the position of your lips that you make when you whistle, or if you're trying to blow out a candle. So you're going to inhale through your nose. Again, it's important to relax your muscles, and you're going to want to exhale for twice as long as you inhale through your nose. This is a very effective method to help manage shortness of breath, and it basically just helps to slow down your pace of breathing. So I'll demonstrate it one more time. In through your nose, and then pursed lip breathing, exhale. You can do this as many times as you need to help to control your shortness of breath. The second technique to help manage your shortness of breath is called SOS for shortness of breathing. Basically, once you start feeling short of breath, you're going to want to stop what you're doing and sit down. It can also help to have a table in front of you where you can place your arms to kind of grab onto something to help with your posture. So for this technique, you're going to put your head down, kind of look past your feet, relax your shoulder muscles, and start breathing in and out through your mouth as fast as you need. So I'll demonstrate. It's important to start focusing on your breathing and to exhale for longer, just like we were doing with pursed lip breathing. In fact, you can also use the pursed lip breathing technique in this technique to help with your breathing as well. So I'll demonstrate it. You're also going to want to begin to use your diaphragm and your rib muscles to help with your breathing because they help to expand the lungs and the chest. You can do this for 5 minutes or as long as you start feeling comfortable again. In this technique, it's important to focus on your breathing and to have the proper posture and to relax your muscles. Once you start feeling short of breath, it's important to remember that this is not harmful or dangerous. It's just really uncomfortable, which is why either of these two techniques can be really helpful in managing your shortness of breath. I hope either of those techniques help to manage your shortness of breath. Some other ways to help improve your condition could be to do regular exercise, to quit smoking if you do smoke, to have a proper posture, which helps to allow for optimum lung expansion, to clear any secretions that you may have, and to just have an overall healthy lifestyle, which includes a healthy body weight and a healthy diet. I hope this was helpful. Thank you for watching.